Alright, well, welcome to this week's episode of Dr. Jawbreaker. Thanks for tuning in. Remember to go down below and subscribe, a couple thumbs up, like the page, leave a comment, all that good stuff. Share with a friend too, that's particularly important. Today we're going to show you a case where previous surgery has already been done. So, extraction of teeth, placement of 4 implants in the upper jaw and 3 implants in the lower jaw. And the plan is to have like bolted down teeth in the upper and the lower jaw. We were trying to be cost effective for this patient, so we decided that we were going to do 1 implant on the bottom, or pardon me, 3 implants on the bottom, 1 in the middle, and make the final restoration kind of right from the get-go. Understanding that if something came loose, that would definitely be a setback, but that it happens so rarely that we should be fine and help save a little bit of money for this patient. Needless to say, it went the exact opposite. The one in the middle came loose. So because that one came loose, what we had to do today, and what we're going to do today, is go ahead and place 2 new implants. So she came in, the lower temporary or lower final restoration was loose and mobile, had been like that for a while, and consequently the implant in the front was also loose. So I took it out, I bone grafted it, and then we let it sit for about 8 weeks. And then we're back here today to actually place 2 new implants. So I'm going to show you the x-ray of what it looks like with the 4 implants on the top and the 3 implants in the bottom. So if you come over here, this is the radiograph just showing 1, 2, 3, 4 implants on the top and then 3 implants in the bottom. And this little fella came loose. So I took it out, I packed some bone in that area, we let it heal, and today what you're going to see is a new implant being placed, 1 here and 1 here, with this already being gone. And then we'll put some little metal discs on there called healing abutments, let it sit for about 3 to 4 months, and then make a bolted down restoration that fits on all 4 of those. So let's go check this out. So the first thing I'm going to do here, Marissa, is make sure things are good and numb, okay? So these implants on either side look fantastic. Just make sure that you're good enough. Feeling anything at all there? Just pressure like this? Nothing pokey, right? Okay. I'll get a Minnesota and a 15 blade. Thank you. Alright, so the first thing I'm going to do is just get it so I can see the area. How you doing? Are you feeling anything at all? Just pressure, right? Shouldn't be anything more than that. And I like to do like a little vertical release in here too to help be able to visualize the area. Okay. So this is where our implant was before. The one that failed. So just get this area exposed so I can see. Fair amount of pressure here just as I get this all visualized, okay? Weird, huh? Doing great. So that's the lingual aspect right there. And out here, you'll find the facial extent of this as well. This portal area has been through it, so the tissue is pretty fibrous, pretty tenacious in there. So this is our labial extent right here. In this area. Okay, goes over here. It's exposed too, so we can get both areas visualized at the same time. So there's the facial extent of our other area right here. You can see the lingual plate is a little higher than the facial plate, so I'll account for that. I'm going to place this just a little bit higher. Okay, so I'm going to place 1 right in here and 1 right in there. So you're going to feel some vibrations here, lots of water. I'm going to turn your head just a little bit right like that, just to get you kind of squared up with the world, okay? Just so that I can see exactly all the angles to get you just right there. Good. So the lingual plate is a nice stable landmark, so I like to kind of see, okay, that's a good direction for the osteotomy. This is where the other implant was. This is where we are. This is where we want to be. Right here. That's the water. come up for just a second. Let's just take a look at that spot, okay? I do like that. I'm going to change it to 13s.
Okay.
And the reason for that is because that other implant is angled, and I don't want it to go so long that I'm getting close to the other implant. That makes sense. Marissa, you're doing fantastic. Yeah, I like that so long. I like the pretty blue, but...
Okay. What is this one?
It's our gold
Is
one.
it also a bag tag?
Let's see. Yeah, it is. It's just for the blue. The blue implants.
That one?
Well, so the 5.0s, actually. Yeah, so sort of the fat ones, but not really the fat ones. So I use this. Use the long one. Come on. Right. See, I'm going to move that one just a little bit here, just a touch more. Really nice dense bone. Pull that off. I'm going with dense bone protocol on this one. Marissa, you're doing fantastic. I'm very happy with her anesthesia and the nitrous and the whole bit. It's going nicely. So I'm going to take this one guide pin out. So now that we have the initial directions and osteotomy is where we want them to be, we'll just step it up and increase it in size just to match the size we're looking for, using a dense bone protocol with this. Great. Always makes me laugh with the broken, not bent. Or just bent, not broken, is that what they say?
Mm-hmm.
So,
right? Isn't that
pink. So she was dreaming. Okay. So now we just increase the size. Is this our final?
Nope, that's the 5.
And we have one in
then
parentheses.
The final, there's a 6 in parentheses if you like.
Okay. Yeah. Saw these guys live. No doubt.
Yeah.
They got the gorge.
Yeah, like Red Rocks Amphitheater in Colorado with Bush.
With the gorge and the gorge.
You saw in the gorge? It's like,
Gorge.
so it's such a similar venue.
Yeah.
It's outdoors, and I haven't been to George in the gorge.
Yeah.
But Red Rocks is outside. It sounds
Yeah,
very similar.
beautiful. Yeah. Yeah, before she went.
With Bush too? Is that when you saw with Bush with her?
Yes, yes.
So it's
Trying to
probably
think when
the
it
same
was.
tour.
Probably
That's fun.
just a couple years ago.
Yeah, we looked at that a while ago.
Before she went on her own.
But it does just seem like yesterday.
It did, yeah.
Okay, so Marissa, what we're doing now is getting ready to put those implants in, okay? You're doing fantastic. So originally, we had this one implant that failed, and so we're putting 2 new implants in, so that we've got a great foundation. Alright, make sure we're not on NASCAR mode, so I've slowed it down. These are the 13s, correct? Fantastic. Nice color. So we're going to get the hand rich. And the gold paints on Marissa. There we go. Doing great, Marissa.
More spotting up over here.
Let's go ahead and section it right there. See how this is. Another plate, nickel plate. Very nice. I'll take that all day long. Excellent. So, one more. It's cousin. I'm sure they're relatives. A little irrigation there. Is that starting to get a little touchy there, Marissa? Is it my fingers underneath? Probably. Yeah, I like both of those a lot. Okay, can I have the thin tray?
Yeah.
Yeah, and the spray hand piece. I mean the pedal, but you get this out of the way. Right here. Let's give you a celery, just to make sure we're protecting the lingual soft tissue. Can you still see there? So right here, the bone's just a little high, so I'm just going to mellow it out just a little bit. Just get a nice smooth contour. As it comes down. There, and we'll come over here too. Thank you. Palpate that, smooth as can be. We'll take it. So now we'll get a couple healing abutments. So now we're gonna put it there. There we go. Thank you. Piece of gauze, because these things do not make good mid-morning snacks. Not at all. These are just what you're going to feel with your tongue, Marissa. This is called the healing abutment. And it's the part that sticks up. Just like those other two have those little metal discs on it, it's the same thing. You did so well. This anesthesia choice worked really well for you.
Is she able to wear her?
So nice that it just camouflages everything. Okay, stitch. So that's the implants in place. Now we're just going to put a stitch or two in. I have a Minnesota. Out of the way. Thank you. Pull through here. Okay. Now what I'm going to do. Good job, Marissa. You did fantastic. Put a piece of gauze on there. Go ahead and just bite down. Alright, you did it. Alright, well, everything went very well with that. I think you could see that the oral diazepam that we used, which was 10 milligrams, plus nitrous oxide, that was the blue mask that was on her nose, which was set at 30% oxygen and 70% nitrous, worked quite well for her. I also used 4 carpules of 2% lidocaine with 1 in 100,000 epinephrine, that's adrenaline, and then also used some Exparel, that's the ultra long lasting local anesthetic that will keep this area numb for about 2 to 3 days afterwards. As you could tell in the video, what I did is prepare the initial osteotomies, or basically holes, put a little guide pin in there to make sure I like the direction, and then increase the size of those osteotomies to match the size of the implant. The implant that I used was a Noble BioCare, Noble Active 4.3 by 13 millimeter implant. That means it was 4.3 millimeters in diameter and then 13 millimeters in length, and then a couple of 3 millimeter healing abutments went on there as well, and then some sutures to close. So if you have any comments, any questions, by all means down below, thumbs up, spread the word, and we'll catch you next time.
%70 overall drop in opioid use, and with the proper understanding and use of Exparel, you too can see the success that Exparel will bring to your clinic. Dr. McLelland, DDS, has been using it in his clinic for a few years now, and he's seen great success in his patients and their pain management every day. In this 6-video series, you get a professional masterclass that will give you the jump start you need to include Exparel in your daily routine. It includes a bonus PDF with a patient information handout, post-op medical instructions, and a quick look sheet for the materials and supplies for explaining Exparel. Go to teachable.com today and get educated on a non-opioid anesthetic that will help your patients have a better day.